Hello dear viewers, today I will teach you about the non-steroidal anti-inflammatory drugs. This lecture is very important for all medical students. You should learn about the basic pharmacology of non-steroidal anti-inflammatory drugs. Now, what are non-steroidal anti-inflammatory drugs? Non-steroidal anti-inflammatory drugs has three types of effect. The first one is anti-inflammatory, analgesics and antipyretics, COX-II, cyclooxygenase 2. So these are the three type of effects which can be studied by non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, it can work to inhibit the cyclooxygenase pathway. As we know that whenever there is inflammations, so during inflammation the prostaglandin synthesis occurs. So in order to block the prostaglandin synthesis, these non-steroidal anti-inflammatory drugs, they are used. Look at this table, and this table you will observe a lot of non-steroidal anti-inflammatory drugs. The first one is oral Nsaids. Oral Nsaids are these are the non-selective COX inhibitors, and the second one is COX-II inhibitor, and the third one is poor anti-inflammatory. As I have already discussed that non-steroidal anti-inflammatory drugs have three types of effect. One is anti-inflammatory, the second one is analgesic, the third one is antipyretic, that is COX-II, and it works by the mechanism of they can inhibit the prostaglandin synthesis in order to inhibit the cyclooxygenase pathway. Now look at here this table, the non-selective COX inhibitor, that is propanic acid's derivative, that is ibuprofens, which is available in 400 milligram per day, which is potent analgesics. The second one is Aryl acetic acids, that is also come under the category of non-selective COX inhibitor. Aryl acetic acid derivative, these are diclofenac sodium and aceclofenacs. You can say diclofenac sodium, diclofenac potassiums and aceclofenacs, which is available in 50 milligram TDS, which is strong analgesic activity as well as antipyretic and anti-inflammatory activity as well. The second one is COX-II inhibitor. So COX-II inhibitor, these are cyclooxygenase 2. So the drugs which belong to this category, that is nemosolides, which is available in 100 milligram BD twice a day. So it is also strong analgesic and antipyretic activities. The third one is poor anti-inflammatory, that is para-aminopenols, and which paracetamol is the basic drugs. Paracetamol is available in 300-600 milligram. It is strong antipyretic pyretic activity, but this analgesic activity. Now these are the ocular indication for use of Nsaid. So as we are talking about the drugs which are used in the treatment of ophthalmic disorders, so Nsaid is also one of the group. So how Nsaid is used in oculars, especially in ophthalmic disorders, and these are the ocular indication for the use of Nsaids. So Nsaid, they are also used for the prevention of intraoperative miosis. So when the pupil size it become reduced in the eye, one is mydriosis, one is miosis. So Nsaid, they are also used for the reduction of post-operative inflammations. The third one is Nsaid is also indicated for the prevention and treatment of cystoid macular edema, which we have already discussed in our previous lectures. Nsaid is also used for the non-infectious uveitis as well as scleritis and episcleritis. while the Nsaid they are also indicated for allergic and giant papillary conjunctivitis, and they are also used after refractive surgery. So these are the different this is the clinical, these are the clinical indication of NSAIDs which are also used for the condition like this. Okay, let's see this table. Flurbiprofen, ketorolac, and diclofenac. So all these are analgesic, anti-inflammatories, and antipyretic drugs. These are the salient features. Look at here. The salient features of flurbiprofen, that is available in 0.03% solution. Ketorolac is available in 0.5% solution, analgesic and anti-inflammatory. It has strong analgesic and anti-inflammatory activity, while the diclofenac is 0.1% solution, potent NSAID with analgesia. Indication of flurbiprofen. So flurbiprofen, its mechanism of action is it can cause inhibition of the intraoperative meiosis. Ketorolac, it has ocular etching due to seasonal allergic conjunctivitis and foreign body sensation and photophobia, while the diclofenac is iatrogenic effect, you can say iatrogenic inflammation and post-cataract general surgery. Now let's see here, these are the dosage. Flurbiprofen, so they are also available in 1 drop every 30 minutes. 2 hour preoperatively, in total of the 4 drops. TDS, retimid, NKOID. These are the side effects which are reported after administration of these agents. Flurbiprofen, so these are the side effects which are reported. So it can cause transient burning and stingings, while it may increase the bleeding tendency of ocular tissue during surgery. Ketorolac, so it may also cause transient burning and stinging and decrease in corneal sensitivity. So these are the various side effects which are reported after the use of flurbiprofen, ketorolac, and diclofenac. Now let's see, these are the newer drugs. The newer drugs are nifafenic, which is available in 0.1%, and bromfenic in 0.09%. They are topical, non-steroidal anti-inflammatory, and recently they are introduced. Nifafenic is a fruit drug which is converted by ocular tissue hydrolysis to amphenicol, which can inhibit the action of prostaglandin H synthase or cyclooxygenase. The patient treated with these drugs were less likely to have ocular pain and myribles, signs of inflammation, cells in flare in the early postoperative period as compared to ketorolac. So these are actually the newer agents which I'm going to explain, like a drug like nifafenic and bromfenic. So these are the newer agents. These newer agents are also indicated for the treatment of postoperative pain and inflammations, cystic macular edema. All these studies have been taken from the latest studies. Now what are mast cell stabilizers and antihistamines? So mast cell stabilizer, human eye has about 50 million mast cells which contain free-form chemical mediators. As we have talked about the non-steroidal anti-inflammatory drugs, so they are responsible to inhibit the prostaglandin synthesis in order to reduce the inflammation. So mast cell stabilizer and antihistamine, these are the another agents. The human eye, and here we are going to study the effects of various NSAIDs on the ophthalmic disorders. So mast cell stabilizer and antihistamine, as we know that the human eye has almost 50 million mast cells which contains preformed chemical mediators. Now let's see here. As we know that during allergic conjunctivitis, the IgE antibody mediated hypersensitivity reaction occurs, and the mast cells and basophil, they are released, as well as accompanied with the mast cells and basophil, there is a secretion of histamine, leukotrienes, and chemotactic peptides. Further, the histamines it can cause stimulations of the nerve endings and capillary dilatations may be occur as a result of increasing the permeability. So whenever the histamine can stimulate your nerve endings, so there is occur pain and itchings, and conjunctivals increase permeability, and conjunctival injection and swellings may be occur. So in simple words, whenever there increase the secretion of, you can say, let's suppose during allergic reaction, antigen and antibody reaction occurs, and these histamines these are the chemicals which must be released during hypersensitivity reaction, antigen and antibody reactions. So whenever these histamine, they are released by the basophils and mast cells, which is present especially at your lungs. Okay, now let's see here, this is the table which is given already. So this is the class, this is the generic name, mechanism, dosage and side effects. Mast cell inhibitors. Now these are the drugs which are the mast cells inhibitors. As we know that during allergic reactions, so the antigen antibody reaction occur and histamines are released, and histamine is the chemical substances which are responsible for allergic reactions. So in order to inhibit or to stop the activity of mast cells, these drugs are used. Chromoline sodiums. So chromoline sodium, they are responsible for the inhibition of, it can inhibit the neutrophil, eosinophil and monocytes, which are also responsible for certain type of allergic reaction. So these are the dosage, which is available in 0.01% BD, and these are the side effects which doesn't provide immediate relief. The second one is H1 receptor antagonist or mast cell inhibitors, that is elastine HCl and epinestine HCl and ketotifen fumarates and nidochromyl sodium. So nidochromyl sodium is also a mast cell stabilizer, but H1 antagonist are mast cell inhibitors, and another agent is olopatadines. The mechanism of action or mode of action of these agents, it can provide the immediate relief and prevent further degranulation and rapid onset, while its dosage is 0.05% BD twice a day. These are the side effects which are reported after administration of H1 antagonist and mast cells inhibitor, which cause ocular burning, stinging and dryness of eye occurs. H1 antagonist and decongestant drugs which are also used in this category, that is nifazoline HCl and pyranamine maleates. The mechanism or mode of action of H1 antagonist or decongestant, so it can relieve short-term relief for mild allergy. So its dosage is 0.05%, which is 0.01% PD. Inshallah, in my next lecture, I will talk about the immunosuppressive agents, how the immunosuppressant agent they are used in the variety of conditions. Thank you so much for watching my lecture.